millions of such kits would arrive, and then we will distribute these kits based on the priority list I just outlined, and we will hand out these kits to more members of the public on the basis of outcome of our sewerage surveillance program. One supplier is from Shenzhen on the referral of the central authorities. We're grateful to the Guangdong province who has undertaken to ask the supplier to work overtime to supply all the rapid test kits we need. So you can rest assured we'll have sufficient number to support our plan to handle rapid test kits. But of course, you may ask whether we're talking about PCR test or rapid test. Now, when there is a preliminary positive case, we have to move on to the next step, and that is where our bottleneck lies, and that is the need for isolation and treatment facilities. Now, for isolation facilities, we are doing our very best to identify suitable places to boost our isolation facilities so that for those tested positive, i.e. preliminary positive cases, they can be isolated at these facilities. Now, because of the development of the pandemic, we have identified the following places to boost our isolation facilities. Now, for public housing estates that are already completed, they will be converted to be used as isolation facilities. You may recall that at the beginning of the outbreak, we used Shenyang Estate for such a purpose. Now we're going to use the Queen's Hall Estate, Blocks 1 and 7, and Hanking House of Liking Estate. Together, they will provide over 3,000 units. Usually, the CHP would require the same family to be allocated to one unit. So 3,000 units or more should be able to accommodate more than 3,000 preliminary positive cases for isolation. Now, these cases have been allocated to people on the PRH waiting list. We will make appropriate arrangements for people affected as a result. We're going to identify more whole blocks of hotels for isolation purposes. We have 8 to 9 hotels being used for quarantine purpose. Now, because stay home safe scheme is now in operation, still we need more community isolation facilities. Now, we're not going to discuss with individual hotels, or rather we will discuss with the hotel industry to work out a plan that will give us close to 10,000 rooms. Tomorrow, I'll personally explore this option with the industry. And through the Education Bureau, we have approached universities that have student hostels. But then we still have students living there. Some are non-local students. So today I won't be able to say whether we can vacate a whole block of student hostel for isolation purpose. We'll continue to discuss with relevant universities. We want the central authorities' assistance. We would like to have a community isolation or treatment facilities. I have no details to report yet today, but preparation is on the way. And as for treatment, I agree with the hospital authorities' practice. Hospital beds should be allocated to children, elderly persons, and people who need urgent care. But then because of the sheer number of confirmed cases, there are people waiting to be admitted. So the hospital authority should step up medical care for those who are waiting at home. Now, the HA has got a hotline, and I understand that at 4:30 PC today, they will announce enhanced measures they will have designated clinics to help to deal with people who have milder symptoms but still require medical care. So if HA has got these designated clinics ready, then the Transport and Housing Bureau has liaised with the taxi industry, hoping that there can be a dedicated fleet of taxis to transport people waiting for communication isolation facilities at home, but who need medical care at designated clinics. Well, they can be served by these taxis to allay the concerns of public transport operators. The Department of Health will provide guidelines for drivers, and these are of the fleet. So when HA has confirmed the locations of designated clinics, we will announce them. We're grateful to the taxi industry for giving us a hand when we are in urgent need. So I mentioned a few bottlenecks, whether we're talking about testing or isolation and treatment facilities. We need assistance from the central authorities. The SL government has discussed with the relevant commissions and also ministries. There was a meeting at Sumjin last week. We agree that 5 task forces should be set up to work on different areas. Since the CS4A gave a briefing to the media after the meeting, and on Sunday, I convened an high-level internal meeting and already issued a press release to give an account of our discussion. I will not repeat the details. I fully understand that given the scale and the sharp rise in cases in this current outbreak, members of the public are naturally worried and anxious, and misunderstandings can arise easily, in particular when there are rumors and speculations appearing on social media from time to time. So I'd like to take this opportunity to make the following 3 clarifications to the public categorically. First, our attitude and position. The SL government is holds the main responsibility in this fight against the pandemic. We are determined and we have the will to move towards a dynamic zero infection in tackling the pandemic. Although the 5th wave of outbreak is the most serious in the last 2 years of fight against the pandemic, we're at a very critical juncture, but then we will brace ourselves again this unprecedented challenge. And the second thing I have to clarify is our strategy and measures. Given the scale of the outbreak, we must consider the nature of the pandemic and keep enhancing, adjusting, and improving our measures, and to boost our capacity. We will not take things lightly. All measures have to be bold, but we'll try to be people-oriented to enhance the public's acceptability. For instance, we understand that restriction in testing is an effective measure, but still it causes a lot of inconvenience to the community. So restriction and testing can last from 1 to 7 days. And during the period, we have to provide 3 meals and other support to members. For instance, we understand that members of the public are worried that they might be infected in the process. So we are giving out rapid antigen test kits, and we don't have any problem in procurement. And as soon as the kits have arrived, we will give them out in large scale to allay the anxiety on the part of the public.
As for some 4,000 close contacts or secondary close contacts at home, since the Stay Home Safe program was kickstarted some 1 month ago, the operation was moved. The 24-hour hotline received some 1,000 calls each day. Support and assistance were given to the callers. For preliminary positive cases waiting to be admitted at home, the hospital authority has also stepped up support for them. The third point of clarification is that the entire Hong Kong SAR government is working in a united manner to fight against the epidemic. Departments and bureaus are working closely together with medical staff in the public and private sectors, testing laboratories, universities, sewage testing teams, and our volunteers. This is a very united force. Civil servants who are used to working in office are working tirelessly as the front lines. Retired civil servants have been enthusiastic in providing the help. For example, in restriction and testing operation, every time some 100 civil servants are needed. The civil servants participating in these operations are usually working in office. They are from the marine departments, social welfare departments, and so on. They took initiative to work together with frontline disciplinary service officers and colleagues from the FEHD and Department of Health to support these operations. With the support of the central government and with the support of the people, we have to fight on. We cannot surrender to the virus. This is not an option. I once again urge people in Hong Kong to maintain your faith and cooperate with our social distancing measures, reduce going outside and keep good personal hygiene, prevent infection, and get jabbed soon. Finally, the Finance Committee is going to have a meeting in this afternoon to scrutinize the government's application of funding of $27 billion into the 6th Anti-Epidemic Fund. I believe legislative members will be supportive of our funding application. After the funding application is approved, we will implement the support measures. Now, we will open the floor for questions. Please raise your hands and please identify your media organization and put your questions to the CE. The gentleman in the front.
South China Morning Post. So, 3 questions. Does the government have plans to impose district-based lockdowns? And if so, how confident is the government that it could be done smoothly given the number of hiccups that we've seen in the past weeks when the government introduced lockdowns to residential buildings? And given all the measures you've just said, including designating public housing estates as quarantine and isolation facilities, and also the plan to build more facilities, do you have the time frame? And also, how many quarantine isolation facilities is the government aiming for? And how many people does the government intend to have them hold? How many people? Last but not least, do you maintain the assessment you made last week that the CE election will not be postponed? Is it among the issues you have discussed with Beijing? And pardon me for repeating the question week after week. Do you still intend to run for the race? Thank you.
Well, first of all, there have been all sorts of discussions and advocacy about a lockdown. In the last 2 years of the whole world fighting this COVID-19 pandemic, different governments have adopted different measures. And city lockdown has also been adopted by some governments, but they differ in a way that this lockdown is being applied. So as far as Hong Kong is concerned, we need to find our own way out of this epidemic. And so far, our measures to contain the spread of a disease remains a legitimate and valid one. The problem we are facing is given the magnitude, the pace of, and the severity of this 5th wave, it has outgrown our capacity. So the immediate response of the Hong Kong SAR government, now with the support of the Central People's Government, is to enhance the capacities at various parts of this anti-epidemic effort. And we are doing this. So I will have to say it very clearly that we have no plans for any widespread city lockdown as you have seen in some of the other places. But the district-based restriction has been adopted for many, many months now. Since the latest wave from the end of December last year, the government has already conducted over 100 such operations, which we call the RTD, the Restricted Testing Declaration. So we prohibit people from leaving their building until everybody has been tested and the results have been disclosed. Whether they are negative, then they can go out. If it is positive, then the Center for Health Protection will follow up the case. And these operations have proven to be effective in terms of identifying a large number of infected cases. And where necessary, in order to ensure the comprehensiveness of the coverage of the RTD, we have to extend the duration of the RTD. So we have been doing 1 day, 3 days, 5 days, and even 7 days RTD. If you refer those to a district-based lockdown, this is a very focused district-based lockdown in order to identify as early as possible the infected cases. But let me stress it again. We have no plans whatsoever to impose a complete wholesale lockdown of the Hong Kong city. Now, the second point about time frame, of course, everything we would like to see as quickly as possible, because at the moment we are already facing backlogs, both in testing and the laboratory for confirmation, in transferring preliminary positive cases to community isolation facilities, and in meeting the most serious cases into hospitals. So in every of the measures to enhance our capacity, we would like to do it as quickly as possible. But from the figures that I have just quoted to you, insofar as the conversion of the newly built public rental housing, we're talking about slightly more than 3,000 units. As I said, one unit sometimes could accommodate the whole family if, unfortunately, members of a family are all confirmed preliminary positive. And in terms of hotel rooms, we know there are over 80,000 hotel rooms in Hong Kong, but not all of them are suitable. We are looking for a wholesale block, so a hotel which is occupying a whole building with a certain number of rooms, because if it is too small, the operation becomes very difficult. So my target is to get them to agree to a plan. It's not individual negotiations, which has been the modus operandi previously, that we approach individual hotel one by one and to discuss the terms and conditions with them one by one. That was not efficient anymore. So we will do a wholesale plan and require them to sign on the plan so as to deliver a few thousands up to 10,000 of the rooms within a very short period. I do not want to use my power, but I do have power under CAP 599 to make a regulation to ask for them, to ask for the cooperation. But I don't want to do that. I want to go down a cooperation model in order to find more hotel rooms for the community isolation purposes. At this moment, the plan for the chief executive election remains the same. That is, nomination period will start later this week, or the 20th of February, and the voting day will be on the 27th of March. But of course, as I just said, one of the things I need to clarify is because of the severity and the speed of this latest wave, we have to continuously review the situation, adjust the measures, and seek additional help. So I could not preclude any possibilities at this moment. And as far as myself, as usual, I'm not going to answer that question. My sole mission now is to lead the Hong Kong SAR government and to appeal to public for support to fight this battle out. Thank you.
係，我哋問多兩位記者，每位記者問
Two more questions, two questions from each. The reporter in the front. I'm from TVB. Good morning, Mrs. Lam. I've got three questions. The first is in this wave of outbreak, the spread of the virus is very wide and quick. For instance, for Kwaichung Estate, within a few days, the virus has spread to Chunwan and neighboring places. Now, to fight the pandemic, why don't we learn from the experience of the mainland and have some medium and mini size of lockdown? Now, if we keep enhancing our capacities, that's sufficient. Aren't we keep overburdening our healthcare sector? Now, we have not so many long queues waiting for testing. Is it because you've relaxed the requirement for mandatory testing? Given that the situation is so grave and you have relaxed it, haven't you given up the strategy that those should be tested? And now, Mrs. Lam, you still insist that you should allow the public to feel your feeling, and therefore you're still not wearing a mask, although the pandemic is so severe. And there are views that you're not setting a good example to the public. And what is your response? Given the gravity of the pandemic, if in the unfortunate event that Mrs. Lam, you got infected, won't you affect our ability to fight the pandemic? Would you affect your electioneering work, assuming that you are going to do so, Mrs. Lam? Now, this is the auditorium of the central government officers. At this forum, I am giving a press briefing, and this is a considered decision. I've already explained to you my decision. There is nothing more to add after I've left this forum, and that is this auditorium, with the exception of my meeting, the Latchco in his chamber. Last time I have adhered to all the anti-epidemic measures. The media were very sharp. Some of you noticed that I was wearing two masks when I visit a hotline center. So please don't keep laboring on this point. We should stand united to fight the pandemic. As a chief executive, I have to be mainly responsible to let the public understand what is the current situation. Your first question is contradictory. Now, if we continue to adopt dynamic zero infection policy, we have to achieve early identification. To do so, we must test people. Now, if we do not provide testing capacity, this is rather pessimistic, because we won't be able to identify cases. As I said, we have to keep adjusting the measures, in particular when resources are limited, but that hasn't. Now, before I came, I was told by the Food and Health Bureau that the waiting time for testing in the community is lower, but the total number of tests done per day is not lower. We're doing over 200,000 tests per day, so we are not suppressing demand to shorten the queues at testing centers. And I think members of the public can be more short. They can get a chip, and then they can check the queue online, and then they can go to the testing station at appropriate time to be tested. And as for district-based lockdown, yes, the purpose is for testing in the mainland. And when we do our DT, the purpose is to test members of the public. So we are boosting our testing capacity and also the scope of testing to achieve early identification. With the help from the central authorities, I'm sure we will be in a better position to carry out community testing. So I've already answered your questions. Last reporter, please. The lady at the back in the middle. I'm from Commercial Radio. Good morning, Chief Executive. Yesterday, it was announced that 5 task forces will be set up, and the conveners are different from what was announced by Mr. John Lee. So for logistics arrangements across boundary, how do you tackle the problem? Because some truck drivers are confirmed, and as a result, we have a fewer supply of fresh food and vegetables from the mainland. Now for the zero infection target you have mentioned a number of times, but we have more and more cases per day, and actually the figures are rising. Will you carry out a universal community testing exercise? Allow me to take the last question first. With regard to more extensive or even universal compulsory testing, now our position is not against it in principle. Our position is when our capacity is limited, we should focus on areas that are more effective. So some buildings may have positive sewage samples, and by contact tracing, we understand that there may be clusters at some buildings. We should focus our efforts on these places by means of restriction and testing exercises. But when we have more testing capacity, we may consider more extensive measures. Please. Now we are constrained by our capacity. As a result, we have to accord priorities to be focused and targeted. Please do not take it or don't interpret it as our unwillingness to do this or that. During the fight, it's hard to be categorically insane or exclude this and that, because we've never seen such a magnitude and pace of outbreak in Hong Kong in this pandemic. So further and more extensive testing in the community may be considered when we have the capacity. But for a PCR testing capacity, we need people to take samples. That means we need the locations, and we need the laboratory capacity. So for rapid antigen tests, can play a supporting role. So we have purchased 100 million rapid antigen test kits starting from today. When deliveries are here, we will distribute them to high-risk places. For instance, if staff in RCHs are infected, or if our frontline workers or cross-boundary lorry drivers are infected, the consequence can be dire, and they need 1 million per day in total. But we have procured 100 million, and more are coming, so that should be okay. Besides, supply is assured. In particular, a supplier is in Guangdong. The Guangdong province has required the manufacturer to work overtime and to ensure supply. So this is okay. You mentioned the task forces. I think the media very much like to cross-check our words or our press releases. When Mr. John Lee went to Shenzhen, he took a few bureau secretaries with him. And after the meeting, it was decided in 5 areas that need to be interfaced. And so there are 5 task forces. So that evening, Mr. Lee could only tell the media that the government will follow up on the work of the task forces. But then the following day, the senior level of government had to make a decision. Now, in this all-out fight against the pandemic, we cannot ask one bureau to be responsible. We can't ask Sophia Chen, the Secretary for Food and Health, to take it up on her own. We haven't been doing that. Take vaccination as example. In the past year, the Secretary for Civil Service, Mr. Patrick Nip, has been coordinating this. Actually, there is some in vaccination has got nothing to do with the civil service, Secretary for Civil Service, but Mr. Nip has shared the workload because of division of labor. So The following day, we decided that interface with the Shenzhen and Guangdong province should be led by these 5 secretaries. But that doesn't mean that other bureau directors will not be involved. Now, if we have cross-boundary issues, of course, the discipline services are responsible, and then the Secretary for Security will assist to facilitate cross-boundary travel, and customs and excise may need to facilitate the clearance of supplies from the mainland to ensure we have sufficient food supply. I hope you understand that the SL government is all united in order to fight this pandemic.
The last question is about the supplies to Hong Kong. The central government is very concerned for people in Hong Kong. Besides epidemic, they are very aware of the issue of supplies to Hong Kong. In the past decades, before and after the reunification, previously the supplies were limited, and nowadays the supplies to Hong Kong are very abundant from the mainland. The central government is very concerned for Hong Kong's daily supply. They will make sure that fresh provisions are being supplied to Hong Kong every day. Now, the epidemic has disrupted the logistics. Every day we have hundreds of cross-boundary truck drivers coming back and forth in delivery of fresh produce. Because of the epidemic, some drivers were infected, or infections took place in the buildings where some truck drivers live. So according to the previous arrangements, these truck drivers were not exempted. The entire batch of drivers would have to be quarantined for 14 days. That has carved out some 20% of the truck drivers from our daily delivery across the boundary. Disruption and delays were caused, and hence it drove up the prices of vegetables and produce. Now, for non-medical supplies, it is the purview of another task force. For daily necessities, vegetables, produce, or livestock, it is under the purview of the Secretary for Transport and Housing, because that is related to cross-boundary truck drivers. A lot of work is being done. For example, we are recruiting more drivers who are not exposed to infection risk. And also for cross-boundary truck drivers, they are subject to a daily test. Antigen test has to be done every day before they can go to work. And also we are looking at water transport. We have container terminals, and we have midstream logistics routes. So we are exploring the possibility of utilizing the sea routes. Now, Mr. Frank Chen may tell you more later today concerning the shortage of cross-boundary truck drivers. Negotiation is ongoing with the mainland authorities. In any event, we will make sure that the daily supply is maintained. So, like I said, we have to maintain faith and we have to work together. Let's comply with the rules and win this battle. Thank you. This is the end of the media briefing. Thank you.